Hello. So I wanted to talk about why the hell people go to the doctor. Most of the time, it's because they feel like shit and they don't want to feel that way anymore, right? Well, I wanted to speak to the psychological, emotional pieces to the physical elements that bring you to the doctor's office. A lot of my patients that come in either they have an acute illness or have some chronic illness that is in a flare state and is impacting their daily life, right? And with that impact, you often run into depression or anxiety. And so, why do we care about that? And why is that such an important element of this? Yes, you can go back to whatever you're doing if you just fix the physical problem, right? Um, Maybe, but and my job is to figure out what is causing the physical ailment and treat it directly in order for you to go back to your normal life. But I wanted to introduce the idea of investigating what is what's going on with the depression, the link between the physical, mental, and behavioral aspects of health, and what it's beckoning in terms of things you might need to change or restructure or return to maintain your health and get back to a healthy equilibrium. And that's really what sickness is. It's often just smoke that is indicating there's a fire that's thrown you off of your normal healthy track. And what conventional medical therapies often implicitly tell you is that you shouldn't be experiencing or feeling or thinking the way that you are. And sure, there are some severe cases where that might be the situation, but a lot of times um, we're not taught or encouraged to investigate what's contributing to the depression, and and maybe there are flares of it that or flavors of it that come up all throughout our life, and that we haven't actually looked at what's under that veil. And Sure, the physical aspects, the hormonal imbalances, maybe an infection, um, maybe the other elements where you're eating certain foods that are contributing to whatever's going on with you, throwing off your sleep, stress, chronic stress, all these things that I consider and need to address. But on the mental health piece, when that really does show up in a strong way or gets worse as the illness is prolonged, and oftentimes I see my patients fighting those things. Many of them are already on an SSRI, so what I mean by it's implicitly telling you that you shouldn't be experiencing depression. And so when that comes up and you're still on an SSRI, it makes it doubly concerning, right? So there wasn't there wasn't any further investigation into what's actually contributing to that and addressing the underlying issues. So the structure was never reinforced or analyzed for its weaknesses. It was just you just slap some cement on it or threw a band-aid on the situation on the wound. So oftentimes things can fester and get worse. Deep psychological pains, fears, grief, uh, trauma, abandonment issues, sexual abuse, all these things that can fester if never given the light of day or processed with someone that can hold space and thoroughly kind of give you feedback and be a sounding board for you as you shine light on that stuff. And why would you want to bring up something painful that may potentially make things acutely a little bit worse? And the reason why I will say that it is important is because and it's important to do it in a secure setting, right? Just like in psychedelic medicine, where you're diving into subconscious issues, past memories, narratives, traumas, things like that. you want it to be in a very safe, secure, um, and therapeutic setting. Same thing's true just for therapy. So being with someone that you trust that is going to actually investigate and ask important or questions that where the therapist is trained or experienced and looking beyond just the words and seeing the themes and seeing connecting dots that you might not be able to do on your own. So the importance of addressing or diving further into pain is that, and this is just one element of it. So the importance of diving into pain is because the more you have greater understanding of what ails you, the more you can, the less grip it holds on you. So the less you're constantly trying to push it down, suppress it, and you can essentially learn how to dissociate from it. So in terms of like thoughts that spiral, you in depression often there's a downward spiral of thoughts, rumination, anxiety, you're often ruminating about things that haven't happened yet, depression, things that have happened that you don't have control over. So in this current state in the world, a lot of people have, these two issues going on. So what do? Throw SSRIs and benzodiazepines at it? No, that's not actually addressing any of the issues. So the what I'm getting at is you can find relief and more sustainable health, and basically it just requires that you're open to being vulnerable with yourself and honest with yourself and with other and with just what's going on in your life. So depression, it's not you, it doesn't define you, it's not how you are, it's a diagnosis. Just like any diagnosis, when people identify with it, then it becomes something more solidified and you run into it more and more without actually just, the diagnosis is not for the patient, it's really for the provider to understand what the best mode of treatment might be for that person. So for patients, focusing on the therapies is really where it's important, and using tools that you can do on your own, gleaning tools from doctors, therapists that are trained to guide or handhold through difficult processing aspects that come up with old narratives or things that have happened in the past that you don't have control over, right? So how to become to peace with those issues. That's really what acute and chronic illnesses bring with them. They typically trigger this reset. You have to slow down, you have to stop, you're not able to do the things that you normally do on a day-to-day basis. So you end up delving back into these reservoirs of old thoughts, grief, fear, things that have happened in the past. It's going to happen. It's going to come up. So figuring out how to just go and look at it, shine light on it, let it breathe. Like any wound, you want it to have air, you want it to have oxygen, you want it to be able to heal. So, yes, it might seem crazy to make things acutely a little bit more rough, but really what the balanced therapy is around diving into depression, anxiety, and what's causing those things, because depression and anxiety are just symptoms. So understanding the causes and then integrating, like in Carl Jung's work, the different archetypes like the shadow work, and integrating some of those darker things that we've become accustomed to or we've had to suppress to survive, bringing those elements of our authentic self back into our day-to-day life so that we're not constantly hiding, which is a stress in itself, suppressing parts of who you are, and basically you end up creating a life that is not true to who you are actually inside. So that stress, those reservoirs of pain often come up when someone is facing an acute or chronic or more concerning diagnosis in medicine. So I run into this a lot, and I have been recently, especially with people that are leaning more into the type A go-getters, people that are used to just go go go, and that's something that I do, that everybody does. I'm not saying it's an on or off switch. I'm saying there are elements that are worth investigating that will lead to less sickness, more ease, more authenticity on a daily basis, and being able to have more genuine boundaries, being able to communicate more effectively, not getting so worked up about everything that if someone does react or basically shows up as basically what I've run into a lot in my own life is people just losing integrity the further and further they suppress certain things. And so gaining that integrity back and being a little bit more resilient. And that's really where this, facing the deeper issues can and should lead to more resilience over a period of time. And so that resilience translates to physical health and translates to less autoimmunity, less immune suppression, less cortisol, and then that translates to being able to sleep better, not getting sick as often, maybe being able to communicate with your husband or wife or your kids more effectively, not getting so worked up when things blow up in your face or life just throws random crap at you. So this is why it's so important and such a powerful preventative tool for acute and chronic illness. I'm not saying acute and chronic illnesses aren't going to still show up in certain ways, but the way you react to them will be different. So that's the important part. So stress, life stressors, random acts of evil or lack of integrity that show up in your life, they don't have as much of an impact the more that you understand your own depths of shadow and things that you've suppressed about yourself. I guess a good example is if someone has grown up around a family that is really focused around public image. I've had this in my own family and and with some patients, but when there's a strong focus around public image and how you present yourself to the world, often there's a lot of hidden things that are going on that are destructive within or behind those curtains, right? So we do that in our own psyches. When we present a certain anima to the world, then there's often there's some things that we're hiding, right? So learning how to integrate more of those things that are actually genuine to us, that are more authentic to who we are, instead of presenting this anima that becomes more and more inauthentic, is what creates and sustains physical, mental, emotional, spiritual health long term. All right. Thanks, guys.